Ruth had two families. She had a smaller family, which consisted of her husband, Don, her son, David, and his wife, Becky, and her sister, her only sister, Judy, and her husband, Steve, and their daughter, Maddie. That was her one family, but she also cared about the larger Silver Cross family. She cared about everyone from those who were cleaning the bathrooms, to every department, to the folks who brought nutritional department who brought food to the doctor's lounge, all the way, including the volunteers. That was her larger family.
She immediately struck me as a dynamic leader, such a wonderful and warm personality, but incredibly intelligent. I could tell just how dedicated and passionate she was about Silver Cross, and very quickly worked hard with her team to turn Silver Cross from a replacement hospital to really this incredible medical campus that we see there right now. It was really just a testament to her passion and her dedication, her intelligence, her desire.
Ruth was just a visionary and an inspirational leader. And what got me about Ruth was, regardless of how accomplished she was, she made everyone feel like they're the most important person in the room. And she really felt like everyone was her friend. And I think the hospital really takes after that. And I think that the sense that they treat every patient as if they're the most important person. And I think that comes directly from Ruth.
I met Ruth in 2013, and her just demeanor and attitude was just infectious. She had a unique way of getting you to see things from her perspective. I really say she's a servant leader, and when you think of servant leadership, it's putting the interests of those who you work with or those you impact ahead of your own. And she was absolutely masterful at that.
You know, Ruth was a natural leader. I don't even know if she realized it. She'd walk into the room and she had a presence about her. She had a terrific smile. She knew how to run a meeting. She knew how to make people feel good.
You know, we all know how much she cared about the mission of Silver Cross Hospital and the people she worked with here at the hospital. And she brought that passion and that conviction to the IHA board. And when we talked about key issues, think back of March 2020, the outset of the pandemic, you know, she was a leading voice for the hospital community across the state of Illinois when we engaged with leaders like Senator Durbin or Governor Pritzker or the director of the Illinois Department of Public Health. And she broke it down and made it very real about what was at stake and why we needed the support and partnership of our state government officials. Ruth was a visionary, dynamic leader who had a tremendous impact here at Silver Cross Hospital. She also had a tremendous impact at the association and on behalf of the entire Illinois hospital community.
Really, one of her biggest goals was to be able to deliver quality care for patients locally so they don't have to travel distances to receive it. And we, as a medical staff, will continue to follow her vision and keep our hospital a top 100 hospital in the country.
So when I came into office, we were at the very beginning of the vaccine coming out with COVID-19. And the county had a little bit of a struggle issue with getting the word out. Ruth was one of the first people to reach out to me and say, how can I help? And from then on, it was instant friendship, instant reliability, instant partnership.
The Healthy Community Commission was formed in 2008, and Ruth thought it was just very important to make sure that the former service area was well taken care of, with healthcare needs, supporting those who wanted to pursue an education and a career in healthcare, and just her vision and her efforts were instrumental in helping get that done.
You know, when you meet people who have this amazing ability to think about the future, you think about Silver Cross Hospital and that visionary leadership that Ruth brought to this hospital. She brought that visionary leadership to the association. And when we had conversations about how do we ensure health equity in the state of Illinois, how do we address health disparities, she was drawing on her experience with the Healthy Community Commission and what she established here in Will County. Ruth did that at Silver Cross Hospital. She brought that voice and that vision to the association, and we were definitely benefited by her great leadership and her great vision.
What I am amazed with was how many people have told me Ruth was her mentor. And I think the legacy she's going to leave is this group of tremendous leaders that's going to continue on with her legacy and push the hospital to the future. And one of the reasons I really wanted to serve as a board chair is to have the opportunity to work with Ruth. I've always admired her leadership style and the way she handled people. And quite frankly, I wanted to steal from it, and I wanted to learn from her. She was very accomplished, very well known, but she was also really fun. I got to have some great dinners with her. I felt like we developed a really nice friendship. And ultimately, I really miss my friend.
Ruth, her kindness, her compassion, will have a lasting impact on me, not only as the mayor, but as a person. What she did as the leader of Silver Cross will have an impact for years and years to come. But who she was as a person and how she touched so many of us in that way, to me, that's the real legacy of Ruth Colby. She built such a tremendous team through her leadership and who she was that they won't miss a beat. And so no one could ever replace somebody like Ruth Colby, not personally or professionally. But we all were fortunate enough to learn from her, and so her legacy lives on.